Hello, this is Will Johnston from the Michigan Institute of Urology. Today I'd like to go over some basics of vasectomy. Certainly this slideshow is not meant to replace a discussion and an informed consent with your physician personally, but it does go over some basics. Again, you can read this disclaimer. The information in this slideshow provides information on vasectomy based off AUA guidelines, but does not replace a consultation and discussion with your physician urologist. Each patient and case is unique, and therefore outcomes can be based on multiple knowns and unknown factors. You should use this as an educational resource to understand the process and some potential risks so that you may make an informed consent. So to start with, what is a vasectomy? It's a procedure to interrupt the flow of sperm in the vas. A vas is not being neutered. It's much different than when you take your dog in to get the testicles removed versus just interrupting the flow of sperm in the vas. So let's look at some anatomy. The testicles make sperm and testosterone, and the sperm is stored in the epididymis, which is just above the testicle. And when you ejaculate, the epididymis empties into a tube called the vas deferens that joins up with the urethra and the fluid that comes from your seminal vesicles and your prostate. So when we interrupt the flow in this tube, obviously sperm do not get down and add to the ejaculation. What a vas should not change. You should still get an ejaculation that contains fluid, but after a couple of months, this should not have sperm within it. Your testicles should still make testosterone and function normally. Your erection should still work. Each patient is unique, and certainly variables in physical and mental health can vary the above. Success rate. Immediate sterility is not obtained after a vas. A man needs to ejaculate 25 times to start to clean out any sperm downstream from the occlusion. This is kind of like blowing out the sprinklers before winter or disconnecting the hose. You can still see some water come out in the hose itself. So you should get approximately 25 ejaculations in over 3 months and then bring a sample in. Some men may require more ejaculations to render no sperm on a semen analysis. When can I have unprotected relations? When you're cleared by your doctor, number one, and you should use contraception until cleared. And a vas does not shield you from any sexually transmitted disease, and this procedure, nor any procedure, is 100% reliable in preventing pregnancy. Reversals, no exchanges, or as my kids say, no takebacks. So you can't simply reverse your decision if you change your mind. So what are your other options? You can certainly have a vasectomy reversal, but it doesn't always work. And you can retrieve sperm directly from the epididymis or the testicle and do in vitro fertilization. But both of these processes are expensive and don't always work. So make sure if you have a vasectomy that this is a final decision that you're making with you and your significant other. What can I do after a vasectomy? No heavy lifting, straining, or rigorous activity for 1 week, and this includes refraining from sex or ejaculating for 1 week. Any kind of movement or straining can cause some bleeding and cause the area to swell up like a tangerine, so you want to take it easy for a week. You can usually return to work the following day as long as you're not straining or moving around too much. What are some risks of the procedure? 1 to 2% complication rate is generally quoted for a vasectomy, and we can see a symptomatic hematoma or an infection at this rate or slightly above. The best way to reduce the risk of a hematoma is to not strain or have the testicles bounce around for a week. Acute or chronic scrotal pain has been reported. Generally, pain resolves with just oral medicines like Tylenol. Any procedure has risk of death associated with it, such an acute event or complication from a DVT or pulmonary embolism or loss of airway, but the overall risk of this is low. According to the AUA guidelines, a vas is not a known risk for things like prostate cancer, heart disease, dementia, or testicular cancer. Anesthetic considerations. Generally, the procedure is done in the office under a local block. You can use Valium if you need to relax for the procedure. But if some people get lightheaded easy with donating blood, giving blood, or seeing blood, or having procedures, then you should let your doctor know, and you could have the procedure done under intravenous sedation or general anesthetic. What to do before coming in? A week or so before, you can use an electric razor to shave the hair on the scrotum so it doesn't get pulled. You should stop all medicines and supplements that may increase your risk of bleeding. You can request a list from our office for things to avoid, such as aspirin, ibuprofen, blood thinners, fish oil, among many. And talk to your primary care doctor before starting or stopping any medicines, even before a procedure. What to expect on arrival? You'll be brought back into a room, and you'll be cleaned and draped. You can certainly bring in a phone and play music, watch videos, or we can have a discussion about what you like to do or what kind of work you do, and hopefully you'll teach me something new. What to expect during the procedure? A local anesthetic is applied, similar to going to a dentist and getting you numbed up. Once we numb you up, you really don't feel much at all. What's the no scalpel technique? Basically, we need to make an opening in the scrotum, and you numb up the area and either make a small clean incision with the scalpel, or you can use a very pointed device to spread the skin, in some ways tear the skin open. And this doesn't result in any more or less pain, but there was a urologist in Texas, as the story goes, that learned the technique from a Chinese doctor, came back and put up a billboard, no scalpel vasectomy. Everyone thought that must be better, must be less pain, but really it's somewhat of a gimmick, and I typically use a scalpel technique unless they're specifically requested for no scalpel technique. What should a man expect after? Ice, ice, and more ice, 5 minutes on, 5 minutes off. The old bag of peas works well. Tylenol for pain the first day, maybe the second day. You can start some Motrin or ibuprofen the next day. You can elevate the scrotum, take it easy. You can get up and move around, go back to work the next day. But you really want to minimize anything that can make the testicles bounce around, because this can lead to bleeding. You may see some bruising and some swelling after the procedure. You can shower the day after the procedure. There'll be some small sutures that will absorb and fall out on their own. If you feel an area that has a little bump in it near the testicle, that's usually a granuloma, which is a normal part of the healing process that you'll see. Follow-up: men or their partners should use other contraceptive methods until vasectomy success is confirmed by fresh semen samples ×2 that are analyzed in the office at approximately 3 to 4 months after the procedure. Even if you have 2 negative semen analyses, there is always a chance that tubes can grow back together or recanalize, and certainly if you're concerned, you can bring in another sample. So in closing, most men have a pleasant experience with the vasectomy. Most couples can find ways to get a good return on their investment. So this is an old Far Side, kind of on the topic. The dog's in the car. He says, "Ha ha, Biff, guess what? After we go to the drugstore and the post office, I'm going to the vet's to get tutored."